Hello, my name is Sharon Dunn. I'm Vice President of APTA. We're here in Seattle at the State Payment and Policy Forum, and with me are two members from APTA. We have Ellen Strunk and Lynn Steffes, and today we're talking about APTA's participation with the American Board of Internal Medicine's Choosing Wisely campaign. We've partnered with the ABIM along with 60 other medical societies in helping patients and providers choose 5 things that they should think about. So after you've had some time to review the list, I'll start with you, Lynn. Are there anything that you think about the list that you think is good for the profession of physical therapy?
Well, probably first and foremost, I'm just really impressed that we're stepping forward with an integrity message. I feel like when your profession stands up and says out loud that our practice needs to have evolved to the evidence that's current and that we want to partner and stand next to consumers in an informed way and talk about what are things they should look for. I think that's really amazing. I think it shows a commitment and it shows the passion that our profession has for what we do. I think that's amazing. I love that. I also think that the particular areas, some of them really strike me.
So your history with treating outpatient musculoskeletal injuries, are there any things on the list that really jump out at you as significant?
Definitely. I think the number one thing that stands out more than anything is really the idea that we're forwarding that physical therapy is an active profession. We are the profession that engages the patients. We're so good at getting people better, but also activating them in their care. So the first statement that talks about really looking at how passive modalities are utilized is so vital. Using passive modalities as an adjunct to care is one thing, but really focusing on them as the core of care, I think is really a concern. And when the APTA comes out and kind of challenges our profession and informs consumers too, to say you have to have evolved to where the evidence is, which means get people up, get them moving, strengthen them, get them functional. That's the exciting thing about what we do, and the education portion of that is huge. So telling consumers that passive modalities, don't look for those. Look for the practitioner that's going to get you up and active. I think that's huge.
Many of us have lived through many changes in practice, and now it's not enough to say something works. There needs to be evidence to justify its use. So using passive modalities as an adjunct to the active things we do is so important. So thank you, Lynn. Next, we'll go to Ellen. Ellen, your practice has been working with older adults. So is there anything that stands out in the list that's specific to older adults that you think is very key?
I think anybody who looks at the list who works with older adults is the number 2 one is going to jump out, and that is the need to really look at the types of exercise that we are prescribing to older adults. Right now, you know, there's a lot of, we see a lot of the baby boomer generation who are coming in and wanting to be more active and wanting to live a higher quality of life. And it's important that we as therapists really think about our exercise prescription, not just a plan of care that includes exercise, but truly an exercise prescription with the correct dose, the correct intensity, the correct frequency, especially these days where we really are challenged with making sure that we use our resources wisely and that we don't have, you know, weeks and weeks to see patients anymore. That's not what they want. That's not what's good for them. So really trying to look at how we are prescribing exercise, making every visit count, I think is going to help them, but also, again, further our profession. Also, there's a couple of others on there that have to do with mainly things that you don't want to do, such as perhaps not using Whirlpool with wounds, but making sure that you're getting people active and not too much bed rest. And so those are important as well. Like Lynn said, I'm excited that this is going out to the consumer because in our neck of the woods, we are kind of new to direct access. We have a lot of people coming in. We have a lot of people asking questions, and I think that's helpful. That they understand more about what we do and the value that we can bring to their life.
So as you read the list, were there things in the list that you felt like APTA and the Choosing Wisely campaign is essentially dictating what physical therapists do with their patients? What are your thoughts on that?
My thought is no. You know, this process started 9 months ago, APTA went out and all members had an opportunity to have a say in what those items were and how they felt about them. So I don't feel like it is. I think that we all, by virtue of being a professional, we all have to look at the context in which we're practicing. We have to look at the context of our patient, because some things are, you can't always say that there's the one right answer for everything. And so I think taking that into account for your particular patient and weighing the risks and the benefits is always number one.
Thank you. So do you think there would be any reason to deviate from the list of 5 things that patients and PTs should look at?
I would think there's always the possibility of that.
I think PTs are, we're not fitness directors that run a class. We tailor our exercise programs to our patients' history, what they need, what the evidence shows us, and what we see as benefiting them. So I believe that there's some interpretation around it, but I think this is a good first step at looking at some guidelines. It's not hard, I don't sense it's hard and fast rules.
No.
I sense that it's guidance, and I like that. Yeah.
And I think clinicians too, especially when they're getting into a new practice arena. I talk with a lot of therapists who maybe haven't worked with older adults before, and so they're looking for some of those things, and always trying to enrich themselves. So I don't see how it can. I don't see how it hurts anybody. It's a good first start.
Great, thank you. One more question for you, Ellen, is how do you think this can benefit the profession of physical therapy in partnering with the Choosing Wisely campaign?
Oh gosh, I would say that just the opportunity to partner with other organizations in being able to say what might be useful, what might not be useful. It is just a good opportunity for practitioners, for research to show that evidence, and with our colleagues in other healthcare professions to be able to recognize that we do want to do what's right. We do want to think about how we are seen in the big scope of things. We're here at the State Policy Forum, where there's always questions about utilization and how we're looked at in the whole scope of things. And so I think it's necessary that we are always looking inward and making sure that we're bettering ourselves.
Thank you. Thank you, Ellen and Lynn, for joining me here. And thank you for watching this dispatch from the State Policy and Payment Forum. If you want more information about us partnering with the ABIM Choosing Wisely campaign, we're very proud to be one of the very first non-physician groups to do this. You can go to APTA's website to integrity.apta.org.